So what's this teeth in a day thing everyone keeps talking about? Hi, I'm Dr. Brett Langston. I'm an experienced prosthodontist and director of the Dental Implant and Aesthetic Specialists in Brookhaven, Georgia. I'm going to walk you through not only what is the teeth in a day process, but how it's done, who needs it, who would benefit, and what our other options are. Teeth in a day is the common reference to a process of replacing all the teeth either on the top arch, the bottom arch, or sometimes both, with a set of implants and a prosthesis that gets attached to them to replace those missing teeth and gums. At one appointment, you come in, usually sedated, remove the unhealthy teeth, we place the implants in, we attach the new set of teeth to those implants, and then you're done. Typically, you heal for about 3 to 4 months, then you come back and we start the process of making your permanent set. Teeth in a day is actually the closest service we can provide to getting you back to where you had all your natural teeth. Big advantage is the materials we use are ceramics, which are very lifelike, and zirconia, which is strong and white and natural. In addition to that, we also replace the missing gum tissue, so it gives you the overall aesthetic and functional appeal of having a full set of teeth. And the other big advantage is they are actually attached to the implants that stay in your mouth, so there's no removing them at night. Teeth in a day is a great option for patients that have a full row of top or bottom teeth that need to be taken out and replaced, whether due to broken down teeth, missing teeth, painful teeth, poor aesthetics. We have other treatment options for treating individual teeth or individual spaces, and the teeth in a day cases are reserved only for doing all the teeth on the top or all the teeth on the bottom. You may think that with such a complicated and involved process, there might be a lot of contraindications as to who can't receive this treatment. Actually, there's only really 2 hard, fast rules that we have to work around when treating a patient. The most ideal patient has the adequate amount of bone and is healthy enough to have those implants heal. The 2 main causes of us not doing teeth in a day are in someone that has uncontrolled diabetes and also people that are on bone growing medicine, such as Boniva and Fosamax. These can be worked around. If we can get the diabetes under control and healing can be expected, we can proceed. We can also consult with your physician to take a drug holiday and work through the bone growing medicines. Like I said, they're not deal breakers, but those are the 2 main issues that we see. As long as you've got healthy bone and a healthy mouth, we can do teeth in a day. The ideal candidate also is someone who has a history of trying removable appliances, whether that's dentures or partials, and can't tolerate having something in their mouth. They are the ones that are mentally prepared and ready to move to something that's permanently attached to their mouth so they don't have to take anything in or out. So how does the teeth in a day process actually work? It may seem like, if you've seen TV commercials, you walk in one day, you meet the team, and you leave 5 minutes later with a new set of teeth. Nothing could be further from the truth. There's a tremendous amount of planning, studying, lab work, and preparing so that the big day goes off without a hitch. The first appointment is basically a records taking, learning your medical history, getting the background information, a 3-dimensional cone beam scan that tells us the exact location and health of the bone and areas where we want to place the implants. Once we've gathered all our information, taken photos, gotten your feedback, then we actually have a separate meeting with myself, the surgeon, my lab technician, and also a computer programmer so we can actually design out your case. The neat thing about these is we actually sit down and we plan out from start to finish, not only how the bone's going to look after we take teeth out, but also where we want to place the implants and where we want to build the prosthesis on top. So the whole thing is planned out ahead of time. My lab technician makes all the parts and pieces. We have everything ordered. We have everything we need, surgical guides. So the day of surgery goes off without a problem. So the next appointment is the big day. That's the one where you're going to come in. A lot of times we do IV sedation or oral sedation. So you are calm, relaxed, ready to go. My surgeon gets you nice and numb. We remove all the unhealthy teeth. We do any modifications to the gum or bone. And then we place the implants. Generally speaking, I like 4 to 6 implants on the top and at least 4 or 5 implants on the bottom. Once the implants are put in the bone, then I actually attach the pre-made set of teeth that we built based off your face and our smile design, and we actually screw those in to the implants. You wake up and you leave with a full set of teeth. It's a really cool process. You come in unhappy with your smile, and you leave happy with your new smile. Does it hurt? How does my healing process go? Very great questions. I like to tell patients that the whole process is no different than just having some teeth taken out. The first couple days or week or so, you're going to be sore. It's going to be tender. But the nice thing is you'll have an appliance in place that will cover those extraction sites And as long as you're eating soft foods and not pushing for that first week or so, the recovery is generally pretty smooth. After a week, we like to tell patients, if you can cut it with a fork, you're welcome to try it. So once you get to about the 2-week mark, you can start eating any food you can cut with a fork. So once we're done with the day of surgery, we have to wait at least 4 months because the body does something really cool. It actually grows bone around those implants, and that process takes time. So about 4 months after the implants have totally grown into the bone, then we're ready to start our final restoration. This restoration is a lot more customized and a lot more personal because we use your face and we design everything to ideal proportions. So what's the cost of this process? Because there's so much planning, time spent, lab work, materials, implants, it's definitely a financial investment. And I like to tell patients that it can be expensive, but you're investing in your mouth and you're investing in yourself. Teeth in a day cases are definitely more expensive than conventional dentures or even implant-supported dentures. But the big advantage is it's something that stays in your mouth and is the closest we can get to having you back to an ideal set of teeth. So what are the drawbacks and the benefits to teeth in a day? The two main drawbacks are that it is a sufficient investment. This is not a cheap, quick procedure that you just come in and go and don't have to take care of. It is a financial investment, but it's a significant improvement in your lifestyle and your smile. The second drawback is that it does take a while. The day of surgery can be involved depending on how many extractions you need, how many implants we're doing, the whole process. So it is time and it's an investment, but it's well worth it. Something to keep in mind is that your mouth and your smile is something you use every single day. It plays a huge part in confidence, function, day-to-day life. So it's not just I'm getting some teeth, it's I'm improving my life. The benefits of this therapy are almost too much to count. Number one, we are restoring your mouth almost back to where it was when you had a full set of teeth. The teeth stay in your mouth, there's no taking them in and out, and studies have shown that the chewing function on these gets you back to about 80% of a full set of healthy teeth. Conventional dentures, unfortunately, only get you back to about 20 to 25%. So you're getting a significant increase in chewing function. Another advantage of the Teeth in a Day appliance is that it's made out of ceramic and zirconia, which are very beautiful, natural, lifelike. So there's no dark metals, there's no gray metals. And they're significantly more aesthetic than conventional dentures, which are made of acrylic and plastic. Because of all the planning and casework and preparation, the patient literally goes from walking into the surgery unhappy with their mouth and leaving the surgery completely happy with their mouth. It's a big change and a big improvement. One of the reasons that we love doing these cases is because we get to go on this journey with the patient. They come in with a lifetime of unhappiness, frustration, sometimes embarrassment with their mouth, and we can work with them, get them to where they want to be, hold their hand and work through the journey, and just the transformation is amazing. These are some of my favorite cases to do. So if any of this sounds interesting to you and you want to know if you're a candidate or if it's a possible treatment that you could be eligible for, please give us a call and we'll do an evaluation. So if any of this was beneficial, hit the like button, comment, subscribe, come and see us. We'd love to talk to you. Until next time, I'm Dr. Brett Langston, helping you watch your mouth.